Welcome to the second session of the Prevention Coalition Affinity Group series. My name is Derek Newby, as you will see in my box, and I'm the TTA specialist for Region 6 of the PTTC and the co-facilitator for today. And TTA stands for the Trainer and Technical Assistant. The Southwest Prevention Technology Transfer Center is based on the University of Oklahoma Norman campus. It serves substance misuse prevention professionals, organizations, and community stakeholders in 5 Southwestern states by providing high-impact training and technical assistance. These programs help to build the professional and community capabilities required to deliver effective and evidence-based prevention program practices and strategies. The Southwest PTTC is part of the U.S. Health and Human Services Region 6, working for Arkansas, Louisiana, Oklahoma, New Mexico, and Texas. This service will be evaluated, and you must complete the evaluation to receive your certificate. So I encourage you to stay to the end, where you'll receive a link or see a link that you'll be able to use your telephone to click on in order to complete the evaluation. Our disclosure on this next slide is written, as you can see, in very great detail. I'll pause briefly for those who would like to read it, and you will be able to download this presentation because we are recording it today as well, if you'd like to review it extensively. It is important to note that the opinions expressed herein are the view of PTTC Network and do not reflect the official positions of the Department of Health and Human Services and SAMHSA. Now I have the pleasure of introducing your facilitator for this service. By design, an affinity group is a group of people linked by a common interest or purpose. Diversity and inclusion within the group impacts the successfulness of the group. It has been said that your vibe will attract your tribe. This group of preventionists that we have today has achieved that standard. And now, Sarah Davis, a subject matter expert around the topic of prevention coalitions, specifically for prevention professionals at the local level, is here to guide us toward our common goal of rebuilding our coalitions. She brings engaging, rich examples of working in various local contexts over many years that adds important practical aspects to the topic of coalition building for ATOD prevention. With experience that many other preventionists may not possess, she will guide us today. Sarah Davis is the Associate Director for the Rocky Mountain Public Health Training Center, housed within the Center for Public Health Practices at the Colorado School of Public Health. She leads a multi-dimensional team of specialists, and we are honored that she will lead us today. Please welcome her and allow her to guide you in this enriching experience. You will get as much out of this today as you are willing to put in. And we encourage each and every one of you to put in and to take away. The light is now yours, Sarah.
Thank you, Derek. That was a great introduction, and I'm loving that our vibe attracts our tribe. So Stephen's already talking about the good vibrations feeling here today. So glad to have everybody here today, and thanks for the introduction. It's really a pleasure to be here, and as we get started, I want to honor and acknowledge where I'm sitting right now here in Denver, which is on the ancestral homelands of the Cheyenne, Arapaho, and Ute nations. They are the original stewards of these lands, and I want to celebrate the many contributions of Native peoples to the fields of medicine, mathematics, government, military, arts, literature, engineering, and so much more. I also want to recognize the sophisticated and intricate knowledge system that Indigenous peoples have developed in relationship to their lands. I recognize and affirm the ties that these nations have to their traditional homelands and the many Indigenous people who thrive in this place, alive and strong. I also want to acknowledge the painful history, and I think we had a firsthand account of some of that painful history at the beginning of the call. The painful history of ill treatment, forced removal that has had a profoundly negative impact on Native nations. I respect the many diverse Indigenous peoples still connected to this land, I honor them and thank the Indigenous ancestors of this place. So thanks again for sharing your time with us today. And we're going to explore the impact that you have on coalitions' decision-making and how you can create a plan to support your coalition in advancing evidence-based solutions. So I want to pause sharing for just a second to talk about a few expectations about our time together. You heard Derek inviting those of you who are able to please turn on your camera if you're able to. Give us the gift of your face, your smiles, your head nods, your questioning looks. It's great to see faces when any of us are looking out onto the screen. So if you're able to, please turn your cameras on. Do recognize that due to low bandwidth, or distractions that you may have going on wherever you're located right now, you may not be able to have your camera on. And if that is the case, I invite you to interact with us and make sure that we know that you're here through the chat. And I see folks engaging that way already, or by using your reactions button at the bottom of the screen. That's a fun new feature that Zoom added in the last few months, is the ability to give a thumbs up or a heart or a laughing emoji. So let us know that you're here with us. Thanks, Richard, for that heart. So let's start by warming up our chat fingers. Some of you are already doing this today. Thanks, Stephen, for adding the land that you're on today and that you were born in Denver. We'd love to hear city and state where you all are right now and a one-word weather report. So where you're sitting right now, go ahead and add it into the chat, city and state, and a one-word weather report. All right, we've got some alliteration from Edward. It's overcast in Oklahoma City. Ryan's about to, Lori in Ryan, Oklahoma is about to blow away. It's so windy. Raining in California. Thanks for being with us, Reba. It's also windy in San Antonio. Good to have you, Vicki. Lots of windy places. That's what we get for at least the southwest parts of us. It's pleasant. It's windy, gloomy. Oh, I'm so sorry, Jason. You're in gloomy LA. We're still glad that you joined us. Sunny and clear skies. Well, hopefully we can channel some of that sunny and clear energy for our time today. It's great to have you all here. So please continue to chat with each other in the chat box as we continue our session today. So one thing I want to mention about some expectations for today, and Derek set us up really nicely talking about this affinity group and the concept of an affinity group. So we all have lots of demands on our time. Likely there were other things you could be doing right now, but you chose to be here with us. So thank you for that. And I really want to encourage you to bring yourself to this affinity group and share of yourself as a way to engage. So ask your questions, because you're probably not alone in having that question. Share the challenge that you're struggling with so that others know that they're not alone, and make sure to speak up and share what's working for you. Share your successes, because we certainly need the tips and the inspiration of what's working well for folks. So why do we have coalitions? Why not just do the work ourselves? Go ahead and take yourself off mute or pop it into the chat. Why do we have coalitions?
I would like to chime in. I feel like coalitions do a great job of understanding gaps in serving the community. So some agencies or organizations do one thing and other organizations do other things. And so they can work together because usually the clients are the same population.
Thanks, Jason.
Mm-hmm.
I have to agree with Jason, especially with having two different organizations. You'll be able to collaborate with them. Maybe if you didn't have resources, but they had them, they can offer each other's resources to help one of another's coalitions kind of grow stronger and bigger.
Great. So Reba, building off of Jason's idea, we've got collaboration, sharing resources, sharing expertise. Share in the chat, add a different lens or perspective that they offer, sharing ideas. Karen mentioned nothing about us without us. It's a great phrase, Karen. Can you unmute and share more about that?
Hi. We use that term a lot just because ours is a youth substance use prevention coalition, and we know that we could easily go ahead and try to plan all the things in the world, but if we don't represent the youth voice for what we're planning, then we're really misguided in our thinking and our efforts. So we just really try to empower youth to bring their voice to the table.
Fantastic. And just as Karen was describing about how important that is for working with young people, we know it's important across the board with the communities that we're working with. Local people solve local problems. Love that. Edward also mentioned getting different perspectives. United we stand, divided we fall. We need a t-shirt factory after this session. These are great. So excellent, great. All kinds of great reasons here for why it's better to do things together, how jointly we're able to bring the magic of the coalitions together. So in the best of the worlds, we have a coalition, which is this incredible partnership of individuals and organizations that are bringing all these different perspectives and knowledge and talents, their expertise, their lived experience, their networks, their perspectives, their resources. They're bringing all of these together, working collaboratively toward a shared vision. And so for those of you who are in a coalition coordinator or coalition leadership or backbone organization role, one of our key roles as prevention professionals is to capitalize on the assets that the coalition members are bringing, plus to provide additional tools like data and knowledge of prevention science, which we can add as prevention professionals. So a key part of the role of leading a coalition or supporting that coalition is supporting the coalition and being able to use evidence to make decisions about how to address the challenges that the coalition is focused on. Some of the challenges that we might face that we're going to really focus this session on might be related to data. Maybe we don't have all the data that we need. That could be due to data collection disruptions that happened because of COVID and nothing was running as it used to for the past couple of years. Or maybe we're working with small rural communities or with specific demographics within the population, like LGBTQ+ youth or Indigenous people, where there has never been great data available. So one of our challenges can be data. Another challenge might be that our coalition doesn't come with the same knowledge that we do specifically about evidence-based prevention programs and strategies. Or we may not have a system in place within our coalitions to make collective decisions about planning or implementation. There's a lot of decision-making that happens in coalitions, but some of us are pretty new to facilitating that or to thinking about how do we collectively make decisions. So we're going to look at each of these briefly. And while we do, I want you to be thinking about which one of these is the biggest challenge that your coalition is currently facing. So let's start with talking about data. So best practices, we've got all of this great national and state data. Often we have county level data as well. So that can be a best practice to start at that top of the pyramid of finding out what data is available for us, for our particular topic area or our particular area. And then we can go to the point of that pyramid and examine the issue further with some local data. And this can sometimes be where we run into some challenges, as we may not have local data or population specific data in the way that we really want to have it. So as we talk more about how we might get some local data, I want to put in a plug for a PTTC training that's coming up next Thursday on the 24th, which is called Ditching the Discomfort with Data, which is a great title. So if you're interested in that, I think we're going to drop the registration link into the chat so that those of you who are interested in diving into data more or want to share that resource with your colleagues can do so. So as we think about how to get some of that local data, your coalition might consider things like focus groups. So that would allow you to hear specifically from a population that you're interested in about a particular topic. You might consider something like key informant interviews. So this can include talking with leaders of other organizations or school personnel or other community or faith leaders. And the point of those key informant interviews can be to gather some insight from their perspective. And that was great that several folks mentioned perspective as we were talking about the importance of coalition. So even if someone isn't a member of your coalition, you might go to them to seek some additional input, some additional perspective based on the people in the community that they work with. They can share their understanding of what the challenges are, and also, perhaps even more importantly, be able to share where some of the opportunities might be. One way to leverage focus groups or key informant interviews is if you have some national or state data, but you're lacking this local data, you can share some of the national or state data with those individuals from the community and ask for their reactions or their interpretations. Which part of that data rings true for them for working with their local community? Based on their observations and experience, do they think the state data matches what they're seeing in their local community? Why or why not? So it can be a way to, again, leverage some of the big data that we have while also getting the local interpretation and local perspective. So other ways that we might consider collecting local data and really understanding the issue that's going on in our community is through observational data. So that might be things like counting the number of liquor stores in a particular neighborhood, or taking photos and documenting what displays of tobacco products look like behind the counter in convenience stores or where they're located. So it could be all kinds of things that help really tell the story. And that can be a great way, especially if you're working with decision makers or trying to influence some policy change, being able to have photos that document, here's the story of what's happening in our community. So that can help add to some local data. You can also think about doing a survey that allows you to hear from a key constituent that's related to the work that you're doing for your coalition. All of these local data collection ideas are also great opportunities for ways to engage some of your coalition members or to partner with other organizations. And I think it was Jason who mentioned one of the assets of having a coalition is that you have organizations that fill different gaps in the community. So identifying what different organizations do or which populations they reach can really help you tap into some of the local data that may be available. So start with what you have access to in terms of data, then get clear about what questions you still have, what questions remain, and that will help you determine what other data might be helpful to have and the best way that you might get it. So there's a nice resource that we're going to pop in the chat from the Centers for Disease Control and Prevention, which is about finding and using health data. So we'll put the link to that in the chat. We'll also share a couple resource slides at the end, which you'll have access to after the presentation that have links to all different kinds of resources that we'll talk about. So the next challenge that we talked about was coalition members not necessarily having knowledge of evidence-based programming. So I was once working with a community coalition in a small gaming town in Nevada that was trying for smoke-free casinos. And it was a large retirement community. Our coalition meetings were incredibly well attended because people had a lot of time during the day. There were a lot of passionate people about the issue. They enjoyed getting together and talking about this. And so as we were discussing a strategy and working to develop a campaign plan, one individual suggested that a group of coalition members should begin to carry water guns and spray people who were smoking in the casino. So several coalition members looked really enthusiastic about this idea, and it seemed like a lot of fun. There were also a few other coalition members who looked a little uncomfortable about this idea. And it was at that point that I realized that we had completely skipped over any discussion about evidence-based strategies, what they were, that there had been research done to develop evidence-based strategies, and how we could use the information that had been gathered over time to help us shape a campaign plan that would help achieve the goals that we were working for. So I'm curious if any of the rest of you have been in a similar situation. So give me a thumbs up, either your real thumb or your emoji reactions thumb, if you've been in a situation where you had a well-meaning coalition member suggest an idea that you knew wasn't really best practice. Lori and Stephanie have been in this situation. Jason and Derek have. Stephen, Kristen. Yeah, so a few of you. Does somebody want to unmute and share the situation that you were in? You can protect the names of the innocent or the guilty. What was proposed that you knew wasn't really an evidence-based strategy?
One thing that was proposed one time when I was a part of a coalition was essentially like picking up cigarette butts and then going and taking them to the Capitol and like just pile them up there in front of the door, so all the city officials would have to see them, and then that would bring awareness to the fact that we had to bring attention to the fact that people were smoking too much in the state.
So a media stunt perhaps, but yeah, not necessarily a proven effective strategy.
Not at all.
How about somebody else?
Come on, I know there's some other ideas out there that people have had.
All right, well, I'll let you continue to drop your examples in the chat if you'd like to share or commiserate. And I'll move on to the next slide here. So a little humor for you with this comic. So ultimately we want to strive for the highest level of evidence possible. So in science, that often means randomized controlled trial. So this group got the drug, this group got a placebo, and we're going to measure the difference between the groups. As this cartoon shows in the fields of public health or behavioral health or education, human services, our evidence looks a little bit different than randomized controlled trials because those aren't always possible or ethical in this particular situation. It can be helpful when we're talking with our coalitions about evidence-based strategies to talk about what we mean by evidence, because they likely have some useful examples from their own fields or own professions, or just from everyday life. So what are some examples, some everyday examples of how we use evidence to make decisions?
Okay, Michelle says, not coalition related, but I was a member of a well-known honor society in college. We're doing an annual cancer walk, and all the officers suggested breast exams at the college. Oh my goodness. The event was held in the common area, which houses floor-to-ceiling windows and a stage. Definitely not evidence-based. Okay, if you want to put them in the chat, you can put them in the chat, your examples of evidence-based.
So how do we make decisions in our everyday lives? What's a good example? We all wear seatbelts.
Good job.
Yep, and Stephen, we probably wear seatbelts not because their fashion statements are comfortable, but because we have seen the evidence that shows that they save lives.
Using information on traffic patterns. Yes.
Yeah, great example, Edward. So whenever we're using Waze or Google Maps, the reason we're using them is because those different programs are compiling traffic data to tell us what's going to get us home the fastest. We're supposed to brush our teeth. That's right. We've got evidence behind that. How do you pick which television to buy or which blender to buy?
Very good examples there. You try to look at all the different results that people have reported on their experience with those televisions.
Yeah. So Kristen mentions we do research on the different brands.
Well, Lori says using COVID numbers to decide activities.
Yeah, that's a great example, Lori. So as each of us were making individual decisions about, do I get together with my family for Thanksgiving? Do I fly to get together with my family for Thanksgiving? We might be looking at data for our own local area or for the area where our family lives. We might be taking into account evidence and data about health conditions that someone in our family has and what is their level of risk. So there are all different kinds of examples in our everyday lives and in the everyday lives of our coalition members where we're using evidence and data to make decisions.
One of my favorites there is cooking, because it's so many times it gets assimilated with the way we do prevention work. Follow the recipe. If you just start taking out things that are in the recipe, you're not necessarily going to get the cake that's on the box. But if you go through the directions and follow the recipe, then you'll most likely come out with the results of the picture that you see on the box.
Great. And I think to take that metaphor another step further, as we're thinking about how do we take an evidence-based intervention or strategy and make it work for our local community, when you look online for those recipes, somebody will say, oh my gosh, I don't actually have oat flour. Is there something I can use instead of oat flour, because they don't sell that kind of flour in my local grocery store? And somebody else will chime in about how you can make your own oat flour. So great example of making sure that you're using the evidence so that you get to the results that you're looking for, and that there are some small modifications or tailoring that you can do while still being evidence-based.
Yes.
So Lori's brought up the point that they hear many people saying, I feel that such and such will work, but they don't have any data to support that feeling. And that's a really important consideration. And lucky for us, we don't have to have done all of the research ourselves, because we have the benefit of having evidence-based registries and reports that we can access. So these are resources where experts have reviewed the literature. They've examined the level of evidence, provided a ranking or a score or a recommendation that let us know what strategies are shown to be effective. So we've got lots of reports and searchable directories that are available. Lori's putting links to those in the chat. They'll also be on the slides that you get after the session as well. So as prevention professionals, this is part of our work, knowing the research of what works and what doesn't, and then sharing that with our coalition so that they have the information to guide their decision-making. We have evidence that shows that scare tactics or talks from people in recovery, DARE, and other Just Say No programs don't help us achieve our substance misuse prevention goals. So knowing that we can play an important role in sharing the evidence that we have with our coalitions so that we can make informed decisions about the strategies that we select.
Oh, that reminds me of all those scared straight programs that they had in the 80s. And what do we have now as a result? More people in prison.
They might have made for good late night television, but not for effectively achieving our goals.
That's correct.
So the third challenge that we've talked about, that we mentioned at the beginning, is we've got the data. We've talked about overcoming some challenges around data to guide decision making. And we've talked about informing our coalitions about the resources that are available around evidence-based strategies. So let's talk about the actual decision-making process itself. This graphic that you see here is the public participation spectrum, and it shows a spectrum of how people might be involved or might be participating. So as we talk about decision-making, I want you to reflect on how you're typically engaging your coalitions right now in decisions. Are you informing or updating them of what's been decided or what the coalition will be doing next? Are you consulting them to get their opinions or feedback, which then influences the decision? Are you involving them earlier on to get their ideas, understand what's important to them, and then use that to guide the decisions about what actions the coalition will take? Are you collaborating with them to identify options, discuss solutions, which then creates the decision that's being made? Or are you empowering them to make the decision? So let's check in with each other and see where we currently are. There's no right or wrong answer. Different coalitions are set up in different ways. So let's do a pulse check of where this group is right now. If you'll go to the top of your Zoom screen, you should see a drop-down menu that says, one of the tools is a little pencil that says annotate. So if you'll click on that white pencil, that will bring up another menu and you can click stamp and click the green check mark or the yellow star and go ahead and make a stamp somewhere on the screen as to how your coalition is, where your coalition currently is on this spectrum. Great. All right, we've got some folks in between consulting and involving, a couple collaborate. Great, let's take another 30 seconds or so for those who haven't had a chance yet. Great, thanks for adding that. Currently in the inform or consult. So you'll see as check marks come on to the screen here that it may be that you have a coalition that works differently in terms of what the particular scenario is or what the particular situation is. And some of you tend to be a little further along on this spectrum in terms of how actively your coalition is involved currently in terms of making decisions and guiding the next steps. All right, so I'm going to clear our drawings right now. And if you will go back to that menu and click mouse, then you'll be set to no longer make stars all over your screen. So a clear element here is transparency and communication. Sometimes we say we're collaborating with the community when we're actually consulting them or involving them in some way. The reality is that many of us may be working on a grant that has a scope of work that outlines activities, timelines, deliverables. And so we can ask ourselves, were the community members, were the members of our coalition, were they involved in the writing of that work plan? Sometimes the answer is yes, sometimes the answer is no. So again, that's neither here nor there. It's important to realize that that may be what the reality is. And it's important to be honest about that with our coalition members. Otherwise, we can breed mistrust and disengagement with our coalition partners. Instead, if we're transparent about what decisions are already made and which are available for the coalition to make, we can actually, using the data and the evidence base, we can actually engender trust and engagement with our coalition partners. So one more note about involving coalition members in decision-making before we move into some smaller group discussions. What this graph shows is, this is adapted from the Interaction Institute for Social Change, and it's about seeking maximum appropriate involvement. And so this shows that the value of the coalition, involving the coalition in decision-making processes, increases as their involvement increases. So if you think about on the x-axis there, as my involvement in a decision increases, so does my level of ownership of that decision that's been made. So if you look at the circle in the bottom left of the graph, it shows a decision that's made by a leader and then announced to others. We're going to do this. In that example, the group likely has low investment or ownership in the activity. They might still do it, but they don't necessarily own it. They don't feel ownership over it. If you look at the top right of the graph, it shows a leader who's delegating the decision to the coalition, perhaps with some constraints, such as we can choose a strategy as long as it's evidence-based or as long as we have the resources to do it. In this situation, the coalition members have a high level of involvement and therefore are brought into the work. They're bought into the work that needs to be carried out. So they have high involvement and high ownership. So what that has to do with coalition engagement, the more involved I am in making decisions, the more invested I am in the activities that those decisions result in. So I can guarantee that any of you who has ever had a child or had 16 grandchildren have seen this in practice. You know, when I get to decide which coat I'm gonna wear, I am more invested and bought into the decision of wearing a coat outside in the snow. So choices do matter, involvement in decision-making does matter. Our goal as coalition leaders and coordinators is to seek the maximum appropriate amount of involvement for each situation. So it requires knowing who has the power to make decisions and what decisions are up to the coalition to make, and what are the constraints that a coalition might need to work within to make a decision. And that could be budget. It could be something like, we can do evidence-based strategies. So now that we've laid out each of these challenges, let's work through some specific solutions for your communities. We're going to go into breakout rooms, and you'll have the option to pick your own room based on what you want to discuss. So our 3 room topics are going to be data, evidence-based strategies, and decision-making processes within coalition. So because we have a big group here with us today, we're going to have a couple rooms set up for each topic. So we'll just ask that you spread yourselves out among the groups so that we don't have any small group that's really big. So the 3 topics to choose from, you should go to the data room if you feel like you don't have all the data that you want for your coalition, either because it hasn't been collected due to COVID or because you're working with a population or area that just doesn't have sufficient data. So you're going to be talking about 2 different questions. What data are you missing? And what strategies might you consider for getting that data? And this is, Lori has put this into the chat as well. So those are the data rooms. You might choose that you want to talk about evidence-based strategies, and that room is going to focus on how you can support your coalition in becoming familiar with and selecting evidence-based strategies. So you'll talk about what the coalition's current level of knowledge about evidence-based strategies is, what do you wish they knew that they don't, and what kind of strategies might you use to educate them about evidence-based strategies. And the third option is decision-making. So for those of you who want to talk about how your coalition makes decisions, what does your current decision-making process looks like, and where do you see the opportunity for involving your coalition in the maximum appropriate way in decision-making in the future. So each group, you'll choose a breakout room. You'll have about 15 minutes in your room. Find somebody from your room to be your reporter when we come back to the large group, because we'll be sharing the strategies across the full group. So remember, this is your chance to ask your questions, to share your challenges, and to celebrate your successes. Richard, I think, is setting up our breakout rooms. So if you click on your breakout room button at the bottom of your toolbar, you should now see the option to join a room. So there are 2 rooms for data, 2 rooms for evidence-based decision-making, and 3 rooms for decision-making. So go ahead and click the room you want to join to. And if you don't see that option, hang on for just a second and we'll make sure you get to the room that you want to be in. All right, I think maybe are we all back now? I think we are. So good to have everybody back. Hopefully you had some nice conversation with a few of your colleagues about a particular challenge that you might be struggling with. So we had 2 groups focused on data, and would love to hear a little summary from one of those groups. What kind of strategies came up in your group for how to deal with some of the data challenges? And I have names of everyone who was in all of the groups, so I can call on you.
I guess I'll share on behalf of my group. So we had talked about just first off, some of the challenges that we have faced with obtaining data and like obtaining up to date and accurate data. It can be difficult and challenging because a lot of times it's just not there or don't really know where to get it. And so one of the people in our group, she mentioned, something that they're doing is looking at the National College Health Assessment survey and pulling like data from there and different statistics to be able to help them with issues that they're trying to tackle. Another person said he's not a part of a coalition, but he's on the board for an organization in his city. And a lot of times they need some of that data too, to be able to benefit them, to be able to help the community that they're working in. And so, yeah, we just mentioned like reaching out to, like public, like city public places that may have data and information, and reaching out to them to pull data from them, going into the schools, the school administration, to get data, even like law enforcement might have some data that could be beneficial, statistics, percentages, stuff like that. And just, like using those resources in the community to be able to find that data, people who do like annual assessments, and then like pulling from those things as well. So that's some of the strategies that we mentioned and talked about in our group.
Excellent. Thank you, Joshua. So I just posted a question in the chat that I'm hoping that some of you can chime in on. Sounds like one of the data groups started to brainstorm some specific data sets that other folks in that group have found to be helpful. Go ahead and drop in your favorite go-to place for data, especially if it's like, oh, wow, I just found this and it's pretty hot. You should know about it. So go ahead and drop those ideas in. And while you do that, let's go to the other data group. Anything that you want to add in terms of a challenge that came up in your room or a particular strategy that you talked about pursuing for finding those data?
I see you. You see me?
How about Jana, Adrian, Edward, Liz, anybody who was in that other data room? Anything else you want to add?
So we, everybody that was in the room that we were in was meant to be, or we all wanted to be in evidence-based, and we all chose the data. So we just stayed there and talked about the evidence.
Good. Tell us what you talked about, Stephanie.
Okay, so we kind of updated and talked a little bit about our specific area in New Mexico. A lot of people I did not know this, I'm newer to this type of work, but in New Mexico, we have the Office of Substance Abuse Prevention Grant, and through that, we work with our local schools. And in our area, we have 3 school districts that we work with in providing, it's called ATOD, it's alcohol, tobacco, and other drugs prevention. And what we do in that initiative is help the schools provide policy in like zero tolerance or anything within that alcohol, tobacco, and other drugs specific. We discussed a little bit about where we get our evidence-based information from. And here we've only used things like SAMHSA, but Derek introduced us to the Wyoming Prevention Depot organization, or the .org, and was kind of showing us how that looked and how to navigate that. And that was what we went over. Do you want to add anything?
Excellent. Thank you for sharing on behalf of your group, Stephanie. How about the other group that discussed evidence-based strategies, and how you might go about educating your coalition or your community partners about those strategies. What other ideas came up?
Well, I was in one of those groups. I think it was room 4. And the biggest part of our discussion revolved around the evidence-based programs we were using in our respective areas and coalitions, and it wasn't an ideal fit in many ways. My specific case is the program that we're using is from 2014 and is out of date, much of it, and doesn't even talk about some applications that are very relevant, like vaping at all. And in other cases in coalitions, the programs available did not seem to be able to be directly, specifically applicable to their population that they were working with. Mm-hmm. So I think there is kind of a disconnect between an evidence-based program that can be directly applied to a general population, and then, you know, I did speak up for, you know, adapting and tailoring it to your population if the overall program fits the mission. And yet at the same time, I think maybe, you know, that's you know, trial and error is part of that, or you know, an iterative process is part of that. Even when you're tailoring it to your population, is the first time around going to work? Does it have to be further adapted and modified? And that's, you know, creates a longer term issue. But so finding the right program for the right, you know, mission and population per coalition can be challenging. And I do think we identified a couple of the places to look, you know, the community toolkit or toolbox. And SAMHSA, the last time I had looked at SAMHSA was when it was changing from a registry or a list to a newer registry. And so I believe, you know, that's maybe up and running now, but it seems like the last time I looked, which is probably pre-pandemic, so it's been a while, that was undergoing this transition and wasn't even usable at that time. So, you know, but SAMS is a great tool. The community neighborhood or community toolkit toolbox is a great resource. And, you know, we then take what we can as seems best to fit us and make it work.
Yeah, great point, Stephen. And that could be a whole other workshop, right? Is on Affinity Group. It's on tailoring and adapting programs and strategies to make them effective for your particular population, because we're walking that line of both wanting to have fidelity to what has been shown to work, and yet recognizing that often the evidence has some bias included in it in terms of, especially for programs, who was the target community for where the programs were implemented, and how similar are those communities to the ones that you're working with. So, so I think you bring up a whole host of different questions and things to consider in terms of balancing fidelity to what the evidence base shows, while also thoughtfully and in a linguistically and culturally competent way, tailoring programs and strategies so that they are effective to the communities that you're specifically working with. So thanks for bringing some of those issues up.
Yeah, and I'll just layer on one more thought, because I remember in school, this was very relative and relevant, was trying to tailor it to in a culturally appropriate way. I mean, there's many different ways to have to adapt it to your population, your specific mission, but trying to get it culturally relevant to the community is so important because of everything that implies, right? Mm-hmm. This doing it one way for this cultural identity will not work for this other cultural identity, just due to the very nature of the lived experience of both groups being different. And so that is really challenging.
Yeah, yeah. And if we think back to our earlier conversation about the value of coalitions and community partners, what a great example of when they come into play, of being able to have members of your coalition who can say, well, here's some limitations of the way this current evidence-based program is currently being implemented and where I see some disconnect with our population, as well as really being a resource for figuring out how are we culturally appropriately implementing this particular intervention or strategy. All right, thank you, Evidence-Based Strategy Group. We have decision-making, 2 groups. Share with us some of the strategies you talked about how to involve your coalitions more in decision-making.
Yeah, I can share. So I was part of one of the groups, and just some of the barriers. We talked about some of the barriers and some of the stuff that worked. So some of the stuff that was brought up was some people in coalitions would want to have a conversation, but not know what proper steps to take, like what is the next step. Other ones is how to get the youth to make decisions for themselves, with some people who have like their youth involved in their coalition planning and leadership. This was something that I had brought to the table, was like unclear leadership due to like sustainability from multiple contracts in multiple places. People come and go, the same things that kind of happen again and again. Someone brings up an issue, but no one really steps up to solve that issue. One of the things that worked was the DFC grant and the strategic prevention framework that offered a lot of structured and requirements. They talked about, like, I was asking questions about like how are they structured. So they had like committee structures with like leadership and action teams, which they thought was very effective. Some of the things that they brought up as well was like volunteer burnout and like swapping out leadership just to keep things fresh and moving, and relying on those action teams to kind of get those the actual work done. A few more stuff. One of the things that was hard was like motivating and delegating, using like communication platforms like Microsoft Teams to communicate and assign tasks. And something that we ended with was training, that everyone needs to have that feeling of ownership, and that comes with like having knowledge and experience. So those are the stuff that we kind of talked about when it comes to like the leadership in our group.
Thanks, Jason. How about the other decision-making group?
Actually, well, as it turned out, most everybody wound up in the same room.
Okay, good. So we had all of the great minds in one room about decision-making. Excellent. So really brought up some ideas around the importance of leadership, not that that person needs to be the decision maker, but that someone can help to facilitate the process of decision making, the importance of communication throughout the decision making process, having those virtual tools to help folks have the information they need in order to make informed decisions as well. So thanks for sharing some of those ideas, Jason.
No problem.
All right, let's share a few final slides and then would like to leave with some resources for folks. I am hoping that maybe we can save the chat, or that someone from PTTC can take a look at the resources that were dropped into the chat by folks, because those are some great ones for data that we might be able to share out. All right, so lots of great ideas came forward. Just to revisit where we started, so as coalition leaders or coordinators of coalitions, that important role that we play of bringing the data, the evidence-based programming, the prevention science into the conversation, and then figuring out how to leverage all of the talents and passion and expertise and resources and networks that our coalition partners bring, so that we can leverage all of that for the decision-making process. So as we come to our closing, let's make some commitments about our next action steps. And to do that, I'd like to use the KISS acronym, and it's not just because it was Valentine's Day yesterday, although it's so appropriate. So pick one letter from the acronym KISS and comment into the chat something that you are going to do. So something that you're going to keep doing, or something you're going to improve on, something you're going to start doing or stop doing when it comes to evidence-based decision-making with your coalitions. So let's ponder that for a moment. Go ahead and drop your comment into the chat when you have the idea. So Edward's going to improve on narrowing data gaps. Stephanie's going to improve relationships with potential partners. Improve on communication. Start empowering individuals to use their voices and don't do for them what they can do for themselves. Improving communication. So much of it comes back to communication. Work on expanding our coalition's presence in the community. What is it that you're taking away from what we talked about today? Data, evidence-based strategies, decision-making with your coalition. What's your commitment? Eric's going for the gold star for the whole acronym. Keep attending meetings, improve recruitment, start expanding to BIPOC groups, and stop being tired of COVID. Ivana's going to encourage partners to contribute data from their respective departments for a greater overview of issues. I love it. Research the available data in the community, start being more active through emails, hopefully viewing recordings of coalition meetings to be more actively involved, keep empowering the youth, allowing them to take on leadership roles, which takes planning and preparation. Great job, Amber. Keep motivating youth to make decisions, improve on using data, help prevention strategy. Stop assuming that the coalition understands strategies. More education may be needed. That's a great one, great reminder for us all, Susie. Keep encouraging youth to climb Heart's ladder. Okay, thank you. So keep dropping your commitments in the chat while Derek wraps us up. I will just quickly mention that there are several training resources related to the topics. You'll have access to these slides and these links. Some of these may be resources for you. Others are great resources for coalition partners as well, or for folks who are not coming from a prevention background. Several different resources that we mentioned, and then links to the reports and registries of evidence-based programs that we talked about today. So with that, I will add my email and website for the Rocky Mountain Public Health Training Center as a resource into the chat. I'll thank you for your engagement and turn it over to Derek to close this out. You're on mute, Derek.
Thank you. That always seems to happen at some point in time to someone in a meeting. Today it had to be me. So prevention, of course, is the one job that I would do even if I didn't get paid. And I'm sure a lot of you have here today feel that same way. How many of you are personally involved in a local coalition yourselves? If you want to use the emoji to raise your hand, let's take a poll real quick. How many people are personally involved? Okay, very good. Yay, look at all those hands. And I think that's one of the great things about the work that we do. We are vested in making sure that we are successful. Sustainability was one of the main topics that we talked about in session one. And it's people like you who ensure that the work goes on. I talked about in session one about the experience that I had and started my first coalition at a college university, and just so proud of it even today. And I'm sure some of you have some of those experiences yourselves. And if you want to open your mic right now and you just want to share one good experience that you've had over these last 2 years with your colleagues here related to prevention, I think that would be such a powerful message to give to each other and a gift to give to each other. Something positive that's happened with your coalitions in your community in these past 2 years, something positive. If you want to open your mic and tell us just one thing positive that has happened.
Since I've not been able to attend as many coalition meetings due to the new job that I took and different life events, my coalition people, my coalition coordinators have been doing a good job of keeping me involved through email and other means. And I'm hoping to continue that and be more active, even though I'm not physically present.
Thank you, Julie. Thank you. We need this. We need to hear these positive experiences. Someone else, please.
I'd like to say that even with Zoom exhaustion, et cetera, this having meetings by Zoom or whatever virtual method has really increased some of our population because we're in a really rural environment and transportation's an issue. And I think that it actually improved some of our coalition attendance for different coalitions. Their attendance went up. People were able to still join. So I liked that in spite of it all.
In spite of it all. Thank you. Oh, that just feeds my soul right there. Thank you. Jason, I think you want to say something?
Yes. One of the things that I've been part of the coalition for about over a year now. And some of the things that we're doing is I also attend other coalitions. And one of the things that we're doing is that we're bringing at least 3 coalitions together for National Drug and Alcohol Facts Week happening in March. And this is the first time I do something like this. And I'm pretty sure this is something new for the community as well. And I'm really looking forward to see how it pans out, all the different organizations and coalitions working together.
Oh, that is inspiring. If there's anything we can do to help you, we're just a phone call away or an email away. Just let us know. You can reach out to us anytime at PTTC in Region 6, and we'll try to get you some resources to try and help you be successful.
Oh, thank you so much, Derek. I appreciate that.
Someone else. Let's keep it flowing. Come on, give me 3 more people. I need 3 more.
Well, one success that we've had was in actually forming a youth coalition during the heart of COVID. And it started out slow, but it's built forward and moved into its 2nd year. And we hope to continue that momentum.
That's inspirational, Stephen. Despite it all, you formed a new coalition during these last 2 years. That's incredible. 2 more.
All right. So we have a community collaboration coalition, and we're having our next meeting actually next week. And one of our goals was to really invite as many educators and teachers as possible to this meeting to be able to chime in and share what they feel certain needs are, and even like invite some of the students who are in the community and some of the youth who are in the community to be a part of it, to get their input and hear their voice on a lot of these issues, because I think it's important to hear the youth as well.
Yes.
And so we're looking forward to that meeting. It's going to be a lot of people have already confirmed that they're going to be a part of it. So looking forward to just, being able to speak with everybody and hear everybody's insight and see where it goes from there.
We are one community. Thank you so much for sharing that, Joshua. The last person, who shall be the last voice for us today?
I'll go. This is Stephanie. We we established, like I said, we worked with our schools pretty frequently, and we established communications with a school that we were unable to get into for any type of prevention. And we did that this past year. That's something we're very proud of.
That is incredible. I remember when this initially occurred, this whole world-changing event, and we, as preventionists, it was like everyone was finally waking up to realize that what we've been doing in the work and how we did our work was a science. It was needed. Everyone in the world started to try to practice prevention. Think about it. Everything these last 2 years has been about prevention. And you guys have been leading your communities and helping them to grow. And yeah, I mean, there have been some letdowns, but just remember to tell each other these stories also, because there have been some good things that have happened during these last 2 years. And a lot of it has happened because of prevention science. People that you started hearing on the television all the time, listen to the science, listen to the science. Well, we know we've been preaching that the whole time, but now the world is starting to listen as well. And I think our communities are going to start to listen more also, because now they're getting a better idea of what prevention is. So we hope you will join us on March 10th for the third session. It's going to be from 1:30 to 3 o'clock. The Southwest Prevention Technology Transfer Center is based on the University of Oklahoma Norman campus. But we're not limited to being on the campus. We serve everyone. We serve substance misuse prevention professionals, organizations, and community stakeholders. And we want you to contact us for training and technical assistance. We are here for you. We are a resource for you. We want to help your programs grow. We want to make sure that you make your communities capable of delivering effective and evidence-based prevention programs, practices, and strategies. And this service, it will be evaluated. You have a voice here. You will have access to the recording, and we need you to complete your evaluation. You can click on this QR code with your phone right now and complete it, but we need your feedback. Not only for you to receive a certificate, but also to provide us feedback so we can continue to grow and meet your needs based upon your needs. If you'd like to share your email address or contact information with someone in here, you can do it in the chat. If you want people to contact you, because I'm just encouraging each and every one of you to use this group for its most effective, as an effective tool, as a network. Because during the third session, we're going to help to facilitate that as well. We want you to have resources beyond your imagination. So sign up today for our event on March 10th. Continue to do the work that you do, and know that you have people, you have a prevention world that is behind you. You have prevention professionals that are behind you. You have people just like you with those same experiences that you can help and that can help you as well. So I without further ado, I yield the last 5 minutes of your time back to you for the rest of your day, and we know how precious every minute is.